Samantha,
Yes, Janet.
my husband, Bob Tennant, is also here.
Oh, awesome. Hi, Bob.
Hi.
Well, welcome, you guys. Thank you for joining us. So we're going to get started. Here we go. You should all be muted now. Okay, well, welcome to our fifth and final session of our virtual summit. We've had a jam-packed week. We've talked about diabetes and oral health, healthy lifestyles. We talked about fall prevention, infection prevention, COVID-19, and today we'll be adding to the conversation. We're going to be talking about stroke education and life care planning. I have an awesome expert with us today, Dr. Robert McGrew, who is joining us, and we're very excited to share these topics with you today. This is being recorded. If you feel uncomfortable, please feel free to turn off your video. The recording will be posted on our website and social media pages. And as you all know, all participants will be muted for the duration of the session, except at the end to answer any questions you might have. I would like to thank some sponsors who helped make this event possible, especially our presenting partners, the Stanislaus County Area Agency on Aging and Kaiser Permanente for helping really put this event all together. I'd also like to thank E&J Gallo Winery for their continued support over the years, Alignment Health Plan, and Independence at Home, a SCAN community service. Some additional sponsors I'd like to mention, Central Valley PACE, MID, Stanislaus Regional Transit Authority, Sutter Memorial Medical Center, and Sutter Gold Medical Foundation. And then we have some of our Sapphire sponsors, Caregiver to You, Catholic Charities, Central Valley Hearing Aid Healthcare, Community Hospice, Health Plan of San Joaquin, Move Stanislaus, Oak Valley Community Bank, PMZ Real Estate, Senior Outreach in Oakdale, SIVA Hospice, Turlock Irrigation District, and Visiting Angels. I recognize most of your names, and I know most of you guys came out and picked up one of our event bags. So we had fun distributing those all week long. So we hope you were able to pick up a bag either in Newman, Ceres, Patterson, Grayson, Modesto, Oakdale, or Riverbank. And we did get rain on a little bit yesterday in Oakdale, but it stayed away for most of the day, which was good. So here's our agenda for today. We're going to talk about some of the videos that were posted on Facebook today throughout the day. And those can also be found on our website if you don't have a Facebook page. Our website is www.healthyagingassociation.org. Yes, all spelled out. And then we'll talk about maybe some services and resources available here, and then questions and answers. At any time, please feel free to send me a chat if you have a question, and we will make sure that it's answered at the end. So I just want to start with what is a stroke. You have some resources in your bag on how to prevent a stroke, but I just want to make sure that we all understand what a stroke is. So very briefly and non-technical, it's called a brain attack. It's caused by a block in blood supply to part of the brain, or it could be when a blood vessel in the brain bursts. And did you know that every 40 seconds, someone in the US has a stroke? So within your summit bag and posted on our website and social media, this flyer is available. So hopefully you saw this in your bag if you had the time to go through all the resources in your bag. So be fast. So time is of the essence. If you know someone may be having a stroke, so check for the 6 points related to the acronym Be Fast. So that's balance, eyes, face, arms, speech, and time. So please make sure that you are fully aware of how to take actions if you see someone close to you is indeed having a stroke. And so I'm going to hand it over for the more detailed explanation and how to prevent strokes through a healthy lifestyle. I'm going to hand it off to our expert, Dr. Robert McGrew.
Thank you very much, Samantha. And I'm on the board of directors for Healthy Aging Association. And it's been my long-term passion. The reason I went into family medicine and worked here in Modesto for many years at Cornerstone Family Medical Group was really my passion for helping people stay healthy, or having suffered a problem, not have a recurrence. So for instance, if you've had one stroke, you can help to prevent another stroke with healthy lifestyle. So we're going to talk about that. So we'll go to the first slide. And I talked Tuesday about, in general, healthy lifestyle. So what I'd like to do right now is talk about what could create a stroke, and particularly highlight the things that are most important for stroke prevention, which are slightly different than diabetes prevention or even coronary heart disease, although they're much the same. So as Samantha showed us, there's two types of strokes. One is a blood clot within the arteries of the brain. Another is what's called an embolus. An embolic stroke is when the blood clot forms somewhere else and goes to our brain. Most commonly, that blood clot comes from the heart, but occasionally the blood clot is in the carotid arteries with severe narrowing, what we call atherosclerosis, or buildup of that kind of hard plaque in the arteries. So one kind of gross story that I want to lead with about strokes is I used to assist on carotid artery cleanouts prior to effective medication, particularly statin type cholesterol drugs. It's very common to find people when we listen to their arteries in the neck. These are the very large arteries in the neck that bring most of the blood up to the brain. Very common to hear this whoosh, whoosh, whoosh sound on one or both sides in a 50, 60, 70-year-old person who otherwise was quite healthy, maybe 80s. And we knew that it was from narrowing in the arteries. When you narrow an artery, you create turbulence. Turbulence creates sound, right? So, so one of the solutions was to do arteriogram, a little catheter, take a picture of the blood going through, illuminated by the dye that the catheter allowed to come into the carotid artery. And sure enough, we see these big narrowings, often 90, 95% narrowings, and know that that person was on the brink of a massive stroke. So we'd go in and do the surgeries and make a line down here, incise it, get to the artery, bypass the artery, slit the artery open, and Dr. Porteous or one of the other heart surgeons would just pull out this really thick, kind of hard, gritty, bright yellow material. And that was the atherosclerotic plaque, which is mostly this cholesterol fat. And I mean, it was the reason it was kind of like sandpaper, almost gritty, was all the calcium that was in there. And calcium gets deposited in inflamed areas. So we now know that hardening of the arteries is caused by high LDL cholesterol levels, that what we call the bad cholesterol. That's a big issue. We know that high blood pressure is a big issue because hardening of the arteries, particularly thinking carotid arteries and the higher up arteries in the brain, are just pound. They're not made for blood pressure over 120 systolic. So if you think of your blood pressure, top and bottom, systolic 120, diastolic, 80 or less. We now know that those kinds of blood vessels persisted into older age in societies where they didn't eat standard American diet. And guess what the acronym is for Standard American Diet? Think about it. SAD. It's the SAD diet, SAD. Samantha's making a face in love, but it is a SAD diet. And it turns out that it's just designed to create hardening of the arteries. So that's heart attack, stroke, hardening of the arteries in your legs, what we call peripheral artery disease. And of course, it's exacerbated by diabetes, but it's very much of a diet-induced problem, as well as other things. So let's go on and look at our risk factors. Smoking, Many of you have never smoked, but if you've ever smoked, it creates a long-term risk for, even if you stopped, creates some risk for hardening the arteries. But the longer you've been off, the better. So we really encourage stopping. Alcohol use. Now, we all know that too much alcohol is not good. Many of us don't know that high alcohol use, and when you're older, that's not very much alcohol. That's we would really recommend limiting alcohol to 3 or 4 ounces of wine, 3/4 of a 12-ounce beer, kind of fairly low intake, because our livers don't metabolize the alcohol fast. So any given amount of alcohol stays in our body faster and has higher peaks. Does that make sense? When does your liver stop metabolizing alcohol as much? Well, basically after you're 40 years old. It's not after you're 70 or 80 or 90. It's it keeps getting more from a fairly early age. So family history, definitely hardening the artery runs in the family. Some people eat anything they want, drink anything they want, smoke anything they want, and still live to 90. We know people like that. We all have had an uncle or a family friend who did that. But just think of everybody else who died early, who could have lived longer with better habits. And if you have a strong family history, which is what I do, grandpa had a stroke and died at 62, heart attacks in uncles starting at as low as 42. Then it just behooves us to work a little harder maybe than other people. And then overweight, obesity. Now, those of us who are over 60, maybe not Samantha, who's young, but the rest of us can remember back to the 1950s and 1960s. If you really think about what did the average American look like, in terms of how big was their tummy? What was their waist size? Look at those old pictures. And really somebody who was 95th percentile in weight, most of them were what we would call, mildly overweight. Well, Joe's a little overweight. Very few people were severely overweight. Now we have a third of the population severely overweight and another third of the population mildly overweight. So big, really hard on your arteries and a predisposition to stroke. And then if you have present known carotid narrowing, if you've had a heart attack, if you know your arteries to the legs are narrowed, we can presume that your arteries in your neck and head are narrowed also, even if you haven't had those tests. So again, more reason to work even harder right now if you know that if you have some issues in that direction. So let's go to the third bullet point, is really what I wanted to emphasize most, which is hypertension and atrial fibrillation. So these are things your doctor's checking and listening to your heart to see what the heart rhythm is. Fibrillation, to remind you, is a palpity irregular rhythm. Boom, 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 boom. As you get older, it may not be fast. This may be 70 beats a minute. It's irregular, but not too fast. You may not even feel it when you're older. If you're younger, like Samantha's age, you're probably going to be really rapid and be real fast, and be uncomfortable. But some of us may not know that we have it, and yet every day that your heart goes in that rhythm is a day that the heart can make a little blood clot and send it up to the head, what we call a embolic stroke. So people who know they're on atrial fibrillation, either intermittently but frequently, or all the time, and there may be some people here, the anticoagulation with pills can reduce your risk back to near normal in terms of stroke, really reduce the risk greatly. Without anticoagulation or without taking it routinely, your risk for stroke is something like 7 times higher than the average person your age. And that's high because the average person our age, over 65, is already has some risk just from age-related issues, right? And then hypertension, pound your arteries. I mentioned that under 120 and 80 is actually what our bodies were designed for. Now, for some of you, that may not be a great optimal blood pressure. Ironically, partly because of hardening of the arteries, you may need a little more pressure to get your blood through there. So that should be up to your personal physician. But for most people, we're recommending at least being under 140 and 90, which may be what your physician is shooting for when you see him or her. And just to go through the rest of the slide quickly, diabetes type 2, certainly a risk for stroke, although we talked more about that in terms of heart disease and even cancer. And prediabetes, which is, oh, your blood sugar is borderline, your cholesterol is pretty bad, your blood pressure is borderline, already carries a lot of risk for stroke and heart attack. In fact, as an example, one of my brothers at 37 called me up and said, Bob, I'm having some chest pain. What do you think it is? I went over to his heart. I didn't think it was his heart. I'm sorry, I went over to his house. Thought it was heartburn. Talked to him for a while, didn't go away, took him into doctor's ER. He had a heart attack starting right in front of my eyes as I rolled into the ER with him. 37, at age 57, he became diabetic. So that's pre-diabetes. He already had these factors in play, and with our family history, it was early. So that could even apply to your sons and daughters. In fact, my daughter is 37, so we can set a good example for them even, right? And then know your numbers. This is where knowing your blood pressure, paying attention to it, asking your doctor, what's my goal? How am I doing? Taking that actively. What can I do to reduce it? Your weight, what's called body mass index is BMI. It's a way of kind of standardizing weight. FBS is fasting blood sugar, and A1C is that test that measures your blood sugar over the last 2 months. And then the final thing about health checkups is, the doctor or nurse practitioner always goes over your medications, and you want to make sure you understand what they're for, make sure that, that you're tolerating them well, and then be sure to take them regularly, because we can plot strokes with medication compliance, particularly blood pressure and cholesterol medicine. We can tell who, from these standardized databases now, we can check, people and group them into people who didn't take many of their pills over a year, people who took a lot of their pills over a year, people who took all the pills over a year based on refills, how many times you refilled during the year. And you can just plot the incidence of strokes and heart attacks based on compliance with the medication. Very powerful. Okay, let's go, Samantha, because I know we have more to talk about. And what's healthy lifestyle? We do recommend considering the DASH diet, which is the DASH diet. You can just look it up on your computer and ask somebody if you don't use a computer. Well, we all use computers. We're all online right now, right? So DASH, put that in your search and look for it. The materials are free. Websites support it. Helps blood pressure, also helps heart attacks and strokes directly, even more than just the blood pressure component. Helps your cholesterol. The Mediterranean diet, one new study was the Mediterranean diet combined with the DASH diet. They're very similar. And this is really the traditional food choices of Italy and Greece. It is not Pizza Hut. Go to Pizza Hut die, as far as, except for maybe once in a while for a treat, right? But in traditional Greece and Italy, they really have very healthy diets, as well as just a great community. They sit there and talk to each other for an hour over dinner, and that helps us enjoy life and also not get strokes. And we already talked about the SAD diet, the standard American diet. Go ahead, next slide. Okay, and then exercise, 30 minutes most days, a brisk walking or the equivalent. I know many of you can't do that. By the way, shout out to Janet and one of my former patients and can't walk. well now, but I know exercise, even in a wheelchair, is possible. And you know, that's what we need to do, get something in. And Samantha, of course, at her staff at Healthy Aging, next slide. I want to give the shout out to the work they do. We're getting back to live classes now for Young at Heart. There's a live Tai Chi class online, Young at Heart. Samantha, is Tai Chi online?
Not at this time, no, just in person.
Okay, well, that would be kind of fun online, but yes, in person, great. Matter of Balance fall prevention classes, are we starting those in person, Samantha?
Yes, Dr. Bob, can you see my slides?
Yes.
Okay, I was just making sure. What was your question?
Fall prevention classes, are we doing those in person?
For a Matter of Balance, we will be starting those up in January.
Okay, so just, you know, all really good. And then exercise and diet, you know, again, together help us in many ways. And by the way, I'm going to talk about Alzheimer's at a November state theater a meeting for families of Alzheimer's. And if you want to slow down the progression of dementia or prevent it, again, you can prevent strokes, which we're talking about today, because tiny strokes are a big cause of dementia. But a huge shout out to exercise. Exercise is the only thing that's really been shown to slow down, to prevent dementia and slow it down. It's the only thing that has excellent evidence that it really works. Okay, next, Samantha, I think you're going to introduce the next subject.
Yeah, so I'll just introduce it briefly and then hand it right back to you. So we're going to talk about life care planning, and on our healthyaging.association.org website and under events and summit, it talks about life care planning and 2 ways to prepare, especially as we go into Dr. Bob's portion of this part. Just think about who would speak for you if you're unable to. And what would you want them to say? Do you already have someone in place who can do these things for you? Have you even thought about this? And so I'm going to hand it off to Dr. Bob to really go into what we're really trying to talk about.
Okay, and I wanted to, as a family doctor, I always wanted to be a good example to my patients. So I'm going to show you that I am a good example in this. This is our binder, kind of old-fashioned, that has wills and all of these documents in it. So I want to encourage you, not everybody needs a living trust, which is more of a financial arrangement and can help with passing down any assets you have to your dependents or your heirs. But certainly just plain old will that you can do even online or with forms that are very inexpensive. I think we all need to have this. It's a huge help for those who survive you. And it's a way we can pass down our legacy to other people. So I just encourage you to do that. It's actually fun to make out in the sense that it's fun to think about how you can gift and bless other people. The power of attorney for finances, again, another really key thing. As we get older, we're talking about strokes. So the reason we're talking about life care planning right now is that a stroke could happen tomorrow, could happen tonight. And all of a sudden you go from a person who is going to get around to doing that well, to doing that advanced healthcare directive, to someone who the doctor, the hospital, the survivors and heirs don't know what your wishes were, Samantha said, or at least you don't have them formally and legally put down. So, you know, this is something to really put on the calendar and to do if it's not already done. So power of attorney for finances is different. I really had to learn this, different than the power of attorney for health, which can be also called advanced healthcare directive. So power of attorney for finances, again, there's a lot of forms for that. Often people see an attorney for that, especially if you're going to do the living trust. Healthcare directive, Advanced Healthcare Directive. This is from Sutter. So Sutter has forms, Kaiser has forms, and often your health plan, if you're non-Sutter and Kaiser, have forms that you can use. So you don't really have to pay an attorney to do it. A lot of things to write down. Primarily, this form is asking, who do you want to speak for you? So just what Samantha said, to really ask their permission. Can I write you down to do this? Oh, and by the way, can we get together and talk about what I would want if this happens to me? And I'd start with something like a stroke, because remember, if the left side of my brain is affected by a stroke, I may not be able to talk or even communicate again. And I can think of a wonderful Christian man that I went to visit for many years in Evergreen Convalescent Hospital, who just never really wanted to stop his candy, never really wanted to take his diabetes and blood pressure very seriously. Wonderful guy, taken with a stroke in his early 70s, and couldn't talk for 10 years or whatever it was he lived after that. So, so hard, but fortunately he had done the healthcare directives and everything else. So that's why we're doing that. The POLST forms, some of you may have seen this pink form. Again, this is mine. It's called a physician order for life-sustaining treatment. So it does need a signature from your physician. Again, I got this from my physician, actually, wanted me to do it. And it's actually meant to be like in your kitchen or on your hall table, somewhere like that. So if emergency responders have to be called, they can see this pink form and go, wow, okay, POLST form, what did this person want? And treat you accordingly, whether it has to do with what type of medical intervention do you want? Comfort, limited, full treatments. Okay, and then hospice. I really recommend finding out about hospice services for you and your loved ones now. An example of what I want to finish with. I'm going to segue into my last slide by telling you about my father-in-law and his experiences with hospice. Now, his wife was a nurse, my mother-in-law was a nurse, and they had all of these forms ready. When my father-in-law had his terminal illness, which was from heart failure and kidney failure related to diabetes, he had a very strong wish. And you know what it was? Never to go to the hospital. He also had a real fear of needles, and he had no desire to be on dialysis, which really conflicted my wife, his daughter, and his family, and his wife, my mother-in-law, who was a wonderful lady, but that's what he wanted. And it turns out that kind of autonomy, the ability to make your own decisions, is really what almost all older folks want. It's really what we want most at the end of our life, is to be able to figure that out. So next slide. So with regard to what Samantha said, my last slide is just reinforcing what she said about telling your heirs, those who would make decisions on your behalf if you're disabled, those close to you, not just children, but friends and larger family and friends, what your preferences are. And this book that I'm holding up by a wonderful physician writer named Atul Gawande is called Being Mortal, Medicine and What Matters Most in the End. So, we'll leave that up if you want to write this down. It looks like a long book, but it's a short read. He is a wonderful storyteller. This is full of stories about people at the end of life and what they wanted. And it's his search to figure out what people at the end of life want. And guess what they wanted most? What they wanted most was autonomy, to maintain some level of independence, and particularly to be able to make their own decisions. And their decisions were always not always what their kids wanted, And as I wrote down, interestingly, the kids, and I can relate to this as being a kid with my father-in-law and my father, what they really wanted the most was autonomy and valued that more than length of life. But what the kids wanted were length of life and safety, reducing risks. So that he tells stories about that will make a lot more sense if you read that. And I think for those of us who are older, we'll really be able to understand that. And the important thing is educating your kids and loved ones about what could happen. Go through the book. It's a great study guide. And say, if this ever happens to me, I want to be like that person. Yeah, they didn't live as long, and they actually didn't stay strapped into their wheelchair to prevent any possible risk of fall. They got on their walker and went. Yeah, they fell, broke their hip, they died, but that's what they wanted. And that's what happened with my father-in-law. He could have lived longer on dialysis, but he absolutely didn't want dialysis. He died at home, surrounded by his family, and that's what he wanted. So that's my closing thoughts. And if we have any questions, be happy to answer them. Or any comments. I see Christy there. Christy, you have any comments? No, okay.
I have a question. Well, my
Yes.
comment is thank you so much for all the information that you are providing to us during this week.
Oh,
And
thank you for coming.
my question is about why when somebody takes coffee in the morning, the blood sugar goes up. My husband, he has diabetes and high blood pressure. Why the coffee, salts in your body, high blood pressure your pressure goes up with coffee?
Right. Well, the caffeine actually energizes you a little bit. As you know, it kind of abolishes that sleepiness you have when you wake up in the morning. And it turns out that it's not really the caffeine directly causing the blood pressure to go up, interestingly. Caffeine doesn't do that, but it's the indirect effects by getting your mind going. But as your mind goes, your stress hormones kind of kick in a little bit, and you get more energy and feel like you want to do something, but that comes at the cost of squeezing the arteries a little bit. Does that make sense? So it's the adrenaline, it's the norepinephrine, it's what we call our energy hormones that kick in the morning, and blood pressure goes up. So good question. But of course, for diabetics, hopefully he doesn't have any sugar in the coffee.
Okay. And my second question, when you say
Yes.
diabetes, before meals, if you check your blood, your sugar, and it goes 102 most of the time, is that pre-diabetes?
102. Well, 102 certainly is very good. And this is before meals, is that what you're saying?
Yes.
Prior to meals, yeah.
Yes.
Right, we normally consider fasting blood sugar in people who don't eat a standard American diet. Say eat a diet with a lot more real food, plant-based foods, not much processed foods, and don't have hardening the arteries. Their blood sugar is usually under 100 if they haven't eaten recently, and then after eating it might be 120, 130, 140. For the standard American diet, what most of us eat, blood sugars under 120 are considered, from 100 to 120 is kind of high normal for before you eat. And then after eating, up to 160, 180, 200 is considered high normal, depending on which guides you look at. But actually, if you're not pre-diabetic and you're eating a good diet, under 100 blood sugar is normal if you haven't eaten recently, and under 120 is normal at all times. So again, just like blood pressure and just like weight, what we consider normal in America now, even what your doctor considers normal, is normal for Americans, not normal, not really what your body was designed for. Does that make sense?
Thank you so much.
Sure.
And Joe?
question. I have genetic or hereditary high cholesterol.
Okay.
I have since I was first diagnosed with it at 21.
Oh, yeah.
And at that time, I was smoking and I wasn't exercising and I was eating the SAD diet. So
Right.
I started changing all of that.
Uh-huh.
And I didn't have to get on statin medications until in my 60s.
Okay.
So I'm in my 70s now. And at first I didn't really notice anything, but my cholesterol levels read better and they still do.
Sure.
But lately I'm getting cramps when I exercise on my hamstrings. Could that be related to the blood vessels in my legs?
No, cramps have nothing to do with blood vessels. Cramps are common as you get older in exercising people. And it's not, although it's known that the statin medications, so these are the strong cholesterol medicines, other people here may be on those like lovastatin and Lipitor, with pravastatin and so forth. The statins are known to occasionally, and really it's pretty rarely, cause muscle irritation, inflammation. And so sometimes the warnings are, muscle pain, but it's not cramps, but we are more likely to cramp as we get older, and especially if we're exercising, which is great that you are, and certainly, as we talked about, really powerful in so many ways. But that's where stretching comes in. So
And that's what I'm doing.
yeah.
I'm stretching and my muscles cramp up.
Oh, well, I would maybe change how you're stretching, or maybe Samantha or Jessica could help you with that, in the Young at Heart class. But I would change how you're stretching. In general, stretching should help to reduce cramps. Are you cramping at night in your hamstrings?
No,
This is during the day.
and basically it's only when I do the bridge, when I'm laying on the ground with my feet, my knees up and my feet on the floor, and you lift your hips, and your weight is on your feet.
That's a hamstring exercise.
Oh.
Yeah. So you're
Okay.
tightening your hamstring, and it's just
Yeah.
So the answer is don't do it.
Okay. Okay.
Yeah, it's just your hamstrings are just too good. I'm sure you have lots of other things you're doing or using your hamstrings, and you're okay.
Okay.
All right.
Thank you.
Any other questions? Okay, Samantha. Well, great questions. I really appreciate people who came all week. Some of you came all week, some just today. That's great. And we hope that you'll, again, continue in our Young at Heart, Matter of Balance, Tai Chi, and other programs. And we hope to be in person next year for our Health Summit. And again, I got us yesterday. I talked about COVID and vaccinations in the context of woody infections, and I am a big proponent of vaccination for COVID, and always happy to talk to people about information. I think it is the best, and I've done a lot of study on this subject. So I'm still working as teaching family doctors locally, and I really think it's our best weapon in terms of defeating this enemy and preventing another, really bad surge. So hopefully we'll continue to make progress in that arena and be back in person more next year.
Perfect. Well, thank you, everybody. Thank you, Dr. Bob. And I hope you all have a wonderful weekend. Stay dry out there and be safe. There's some flood warnings in our area, so just be careful, okay? Bye, everyone.
Bye. Thank you very much.
Oh, you're welcome. Well, Samantha, are you, is this the last I'll see you?
No.